This module will tell you where to find the bronchoscopy cart at each hospital and how to prepare all your equipment before the procedure. We will review the basic components of a bronchoscope and how it works, and what to do with the equipment when the procedure is complete. Finally, we'll go over a few common equipment problems and how to troubleshoot them. For bronchoscopies in the ICU at UWMC, talk to the nurse ahead of time to order sedation medications. Otherwise, all the equipment you need is located in the 5 East hallway between the front desk and the medicine ICU team room. Open the sliding door and pick up a bag full of supplies, a manila envelope with the necessary paperwork, and a bronchoscope. Note the sterile sleeve housing each scope. After you clean the scope at the end of the procedure, you will put it back in this sleeve and place it in the dirty scopes drawer, so don't throw the sleeve away. Be sure to close the door before you wheel the cart to the patient's room. The protocol for performing bronchoscopies outside the UW-ICU and at other hospitals varies. For more information at UWMC, contact bronchoscopy RN Sharon Kelso at 598-4615. Information for the other hospitals is at the end of this module. In the room, make sure you have ordered appropriate sedation medications, so these will be ready by the time you're set up for your procedure. Use the cord on the back of the bronch cart to plug the cart into the wall socket. You'll then need to plug in the bronchoscope itself. There are 2 steps to this. First, plug the bronchoscope into the lower unit and then connect the top unit. Let's watch a close-up of that. The end of the bronchoscope has 2 rods that insert into the lower unit of the machine. The video card then connects to the larger rounded opening indicated here. Make sure the larger rod is on top as you insert the bronchoscope into the lower unit and click it firmly in place. To attach the video card, line up the dot with the line nearest the bronchoscope cord and twist clockwise until it clicks into the second line. Turn on the power to the cart with the very topmost button, and then turn on the lamp by pushing the button on the lower unit. Note you do not need to press the individual power buttons on the top and lower unit of the bronch cart machines. When you're sure your equipment is working, take a moment to lay out all of your tools. Everything you need for the procedure, including inspection and bronchoalveolar lavage, should be in the plastic bag. The tools you need for biopsies or retrieving foreign bodies are not included in this basic kit. Let's talk about the equipment you'll be using. This plastic device is called a swivel. It allows you to perform bronchoscopy through the endotracheal tube. You will break the circuit between the tube and the ventilator. This end of the swivel attaches to the endotracheal tube, and this end attaches to the ventilator tubing. This flange then can open and allow you to insert your bronchoscope through the swivel and down into the endotracheal tube, maintaining airflow between the ventilator and the endotracheal tube. You'll see this in action in the later bronchoalveolar lavage video. Before you start the procedure, you want to get your first bolus of lidocaine ready. There are 5 vials in the bag, which should be more than enough for your procedure. Label the syringe, then pop the top off the vial and attach the syringe to the plastic needleless system to drop 1 cc of 2% lidocaine for each bolus. Next, get your saline ready for lavage. For bronchoalveolar lavage, you will want 30 ml aliquots of saline. Even if you are only doing an inspection, it can be helpful to have saline ready in case your vision is obscured while you're in the airways. Spike the saline bag by pulling off the blue tab and inserting the tubing spike. Attach the 30 ml syringe and make sure the stopcock is open to the syringe to draw up 30 mLs. During the procedure, when you remove the syringe to administer the saline, don't forget to turn the stopcock so the bag doesn't leak all over your table. Next, prepare your specimen trap. We'll talk more about that in a moment, but it's helpful to open the trap and apply a patient sticker before you start the procedure. We have had cases of specimens lost for want of a patient sticker because this was left to the end of the procedure when everyone was busy and the step was missed. Here's all your equipment laid out in the order in which you will use it. The swivel, 2 attachments for the bronchoscope, which we'll show you how to use in a moment, lidocaine with the first 2 mLs already drawn up into a labeled syringe, lidocaine jelly, which you will apply to the end of the bronchoscope using the gauze just prior to inserting the scope, saline with the first 30 ml aliquot already drawn up, and the stopcock on the tubing spike turned to closed. Finally, at least one specimen container already labeled and ready to attach to the bronchoscope. The suction port and button on the bronchoscope are disposable. Here's how to attach them. You'll insert the suction port lower on the handle by pressing firmly until it clicks. The suction button, to which the wall suction attaches and which you will press with your finger to activate the suction, is placed higher on the handle and can be tricky to insert properly. Some providers can get it seated correctly with one hand, but those with smaller hands may need to use both thumbs to make sure it's pressed firmly into place until it clicks. While you're doing the procedure, to obtain lavage specimens, you will attach the specimen trap to the long arm of this piece. The flexible tubing attaches here, and the wall suction tubing attaches to the rigid port here. We'll show you how to use this in real time in the BAL video. Let's talk about the parts and movements of the bronchoscope itself. On the handle of the scope, there's a thumb lever. This, along with rotation of your wrist, is your primary means of directing the scope. You'll see that it's labeled rather counterintuitively. At the bottom, there is a U for up. When you use your thumb to push the lever in this direction, the scope anteroflexes. Note that you get nearly 180 degrees of anteroflexion if you push the thumb lever maximally in this direction. The other direction is labeled with a D for down. By moving your thumb in this direction, the scope retroflexes, but just over 90 degrees. There are several buttons on your scope. First, the suction button, which you've just inserted. Suction is not applied through the bronchoscope channel until you push this button down. The two buttons on the back of the scope, labeled 2 and 3, do not have functionality on this bronch cart. The two buttons on the front of the scope head are near your index finger while it's holding the scope. This will freeze the image on the screen and take a picture to record that image. Troubleshooting common problems related to the bronchoscope machine's setup. Common problems usually revolve around the power supply and the video connection. After you plug in the machine to the wall, make sure that the main power button is on and the lamp button on the lower unit has been turned on. The last user may have turned off the individual power buttons on each of the upper and lower units. Make sure you leave them on at the end of your procedure, so the next user only has to press the main power supply button. Regarding the video image, if you are having trouble seeing the picture, make sure that your bronchoscope is properly inserted into the lower unit, the video card is firmly attached to the bronchoscope, and the lamp is on. If you see a color-blocked image on the screen, it's likely that the video card itself is not properly inserted into the top unit on the cart. Make sure that the surface of the card that has the word up actually faces up and that the card is inserted all the way into the slot. The protocol for performing bronchoscopies outside of the UWMC varies. At Harborview, call the bronchoscopy respiratory therapist, usually Jillian Simmons, at 744-7537, or you can page her at this number. Occasionally, a bronchoscopy RT will not be available, but Jill has created a handbook to walk you through doing everything yourself. At the VA, on weekdays, Barb Michael and Shelley Howe are the RTs who run the PFT lab, and they'll assist you if they're available. It's easiest just to find them in person in the pulmonary department. The bronch cart is kept in closet 4D140 in the pulmonary department. Get the door code from your attending at the beginning of your rotation. To open the door, be sure to turn the door handle all the way to the right. Everything you need should be on the cart, including a bronchoscope, with a standard 2mm working channel. If you need a larger channel, say for foreign body retrieval, you'll need to use one of the scopes hanging in the bronchoscope locker in the bronch suite. The gray box on the bottom has tools like forceps, a foreign body retrieval basket, and brushes for cytology and microsamples. After the procedure, you'll use the standard cleaning packet and place your dirty scope in the red box and call decon to collect and process it.